Everyone's up in arms about our healthcare system. We're the richest nation on the planet, with the most expensive healthcare, but with the least healthy people. How did we get into this mess? At one time, healthcare was a basic service individuals purchased from their doctors. Our demand was limited by our ability to pay. Doctors could only charge what we could afford. In any event, most medicines and procedures weren't too expensive. In extreme cases, doctors might do pro bono work, and charitable groups would step in, like the Shriners. This arrangement began to change during World War II. To ramp up wartime production and control inflation, the government imposed wage and price controls. To circumvent the wage restrictions, some employers, such as Henry Kaiser, began offering medical care to their employees. He needed a dependable army of workers to turn out ships for the war. He offered housing and medical care for his workers and their families. As this innovation spread and expanded after the war, it would have a profound impact on the healthcare market. In the beginning, employer-provided healthcare made sense in many ways. Employers could negotiate better prices by buying medical insurance for a large group than individuals could get on their own. They could then offer coverage as a perk or benefit that effectively cost them less than the value placed on it by their employees. Constraining wage costs helped their bottom line and bought some loyalty from their employees. Employees got a deal by saving money and getting insurance to cover catastrophic illnesses. However, this new arrangement turned the medical system's incentive structure on its head. Before, patients had a financial incentive to stay healthy, or at least minimize their visits to the doctor. Doctors could only prescribe what their patients could afford. Now, with medical insurance, patients don't need to worry about how often they see a doctor or what it costs because the insurance company will pick up the tab, as long as it's covered, that is. Doctors now don't worry about what patients can afford. They're just concerned with how much the insurance companies will cover. Also, since they're paid by the visit or by the procedure, the more treatments they prescribe, the more money they'll make. So demand went up and up and up. Early on, this wasn't a problem, as long as medical prices stayed reasonable. But the rising demand, coupled with new technologies that led to better but more expensive treatment, sent medical prices off to the races. They consistently outstripped all other consumer prices. More importantly, the demand for medical care is very inelastic. This means that patients are willing to pay whatever it takes, and the sky's the limit when someone else is picking up the tab. This is where things start getting tricky. Insurance companies are not in business to keep us healthy. They're in it for the money. Running an insurance company is like running a casino. They bet on the probability that someone will need medical care. The more they need, the less profit the company makes. There are a few tricks, though, to keep the profits coming. One is to limit what procedures they'll pay for. This often comes as a great shock to many policyholders when they learn that something essential is not covered. On the other hand, the insurance companies can improve their odds if they only insure people who don't get sick. If they could screen out people with the greatest odds of needing treatment, they could limit what they paid out in claims. The easiest thing to do is to refuse to cover anyone who's already sick. Think pre-existing condition. This is the main reason why people most in need of medical care can't get it. Beyond that are steps like physical exams and even genetic testing. Since employers buy so much insurance with group policies, another approach is to get them to do the screening. Thus, it's not uncommon for employers to require pre-hire medical exams or to even fire employees with unhealthy habits, like smoking. Of course, since the medical insurance industry is not really that competitive, they can also simply pass these costs on to the employers that pay the premiums. This is really why medical care has become such an important Main Street economic problem. Unfortunately, employers are also more concerned about profits than they are with their employees' health or the efficiency of the healthcare system. Rising healthcare costs lead to higher compensation costs and thus lower profits. There are several ways employers can deal with this. First, they can make their employees pay a greater share of the cost themselves. They can buy policies that don't cover as much, or they can offer policies to fewer and fewer employees. So the ranks of the uninsured keep growing and growing and growing. Unfortunately, many companies like General Motors offered lifetime medical insurance as a retirement benefit back when costs were reasonable. There's not much a company can do to get out from under this obligation, though, except go bankrupt. Overlaid on top of all of this is the one big factor that makes this a ticking time bomb: aging baby boomers. The population is rapidly aging. As people get old, their demand for medical services skyrockets. This means that medical costs are only destined to continue rising for the foreseeable future. Of course, through all of these developments, we've used government as a backstop. Since we find it morally repugnant to let someone die because they can't afford treatment, government's participation in the medical industry has expanded steadily. From creating and expanding Medicare and Medicaid, to supporting a vast network of state and local hospitals, clinics, and insurance programs, the government's role is now essential, but vulnerable. As much as we don't like being denied medical care, we dislike paying taxes about as much. Unfortunately, with less coverage being offered by the private sector, government medical expenditures have grown faster than medical costs generally. The expansion of Medicare in 2003 greatly expanded the federal government's obligations and added more fuel to medical inflation. So even the public sector is cutting back. We're faced with previously unthinkable choices. We can either limit access to medical care, or cut education, or law enforcement. You choose. So here we are with a messed up system that nobody likes. Not the doctors, not the patients, not employers, certainly not taxpayers. Doctors spend ever more time dealing with paperwork and the Byzantine rules of insurance companies rather than worrying about their patients. Patients just want medical care when they need it and don't want job and career decisions to depend on their access to health care insurance. They also don't want catastrophic financial surprises when their health turns south. Employers would like to get this element of their cost structure under control. Many globalized companies find themselves at a severe disadvantage when they compete against companies in countries with lower medical costs or nationalized health care. And guess what? We're the only advanced country without it. Oh, but there is one group who likes the system just fine: insurance companies. They make dandy profits year in and year out. In fact, because of the baby boomers and medical advances, their business is doing better than ever. And to make sure no one upsets the apple cart, they've made substantial investments in politicians to make sure that things stay the way they are. How much longer do you think this can go on?